With more parents reporting for duty, what about their children? While countries like South Africa as well as the USA are grappling with the reopening of schools, Kenya has scrapped the 2020 academic year. And the continent welcomes the Africa Foreign Press Association. We're in conversation this evening with its chairperson, Kennedy Wandera. Good evening, I'm Aldrin St-Pierre, and this is African Perspective. We start off the show with the news of the passing on of the Ivory Coast Prime Minister Amadou Gon Coulibaly. His death comes just a few months ahead of the October presidential elections, which he was going to contest. Gon Coulibaly, 61, became unwell during a weekly cabinet meeting and was evacuated to a hospital where he passed away. The UK has two vaccines. Meanwhile, and this is a different story, apologies for that. The UK has two vaccines in human trials, one being developed by London's Imperial College as its early stages in phase 1 with a small group of people involved. The other being developed at Oxford University is further ahead in phase 2 and phase 3 trials. Thousands of people in UK as well as Brazil and here in South Africa are currently being given doses of that. But there are concerns amongst developing countries about the fair access to the vaccine. Should it succeed, will it be guaranteed? Stuart Smith reports from London.
Although there are two vaccines currently in human trials from the UK, most eyes are focused on the Oxford University one simply because it's at a further stage of development. It's currently being tested in thousands of people, not just in the UK, but also in South Africa and Brazil. And there are two reasons for that. One is that they want to make sure it works and is safe in a broad global context, but also, sadly, the rate of infection in the UK is too low compared to South Africa and Brazil and other countries with high rates of infection. So they've gone there to speed up the process of getting results as to whether the vaccine works. At a minimum, they say this will take 2 months' time, so late August potentially, but at the most could be half a year or longer before the results start coming in about whether it works and whether it's safe. Despite that, there are already pre-orders coming in from countries around the world. The UK has asked pharmaceutical manufacturer AstraZeneca, which is based in the UK, to be in charge of manufacturing and distributing the doses of the virus should it be found to work. So the UK have 100 million doses ready to go, but also 400 million orders from the United States and a further 400 million doses ordered by the European Union and other European countries. What about developing countries? Well, two charities that specialise in vaccine distribution, CEPI and Gavi, have ordered 300 million doses of this vaccine in the hope that they can get it out quickly to developing countries. That's what they specialise in, distributing vaccines to developing countries. But there's also another route, which AstraZeneca have found with India. They have agreed to order 1 billion doses of the vaccine, but on the condition that India gives a proportion of those doses to low and middle income countries. We don't know how that will be worked out, by what ratio that will be decided, but it's another route by which developing countries could potentially get their hands on this vaccine if indeed it is found to be safe and that it works. Stuart Smith, SABC News, London.
Meanwhile, as the number of coronavirus cases in the United States tops 3 million, the Trump administration is accelerating its push to find a vaccine. Operation Warp Speed, as the program is called, has given $1.6 billion to U.S. biotech firm that hopes to have the vaccine on the market by next year. But as Trump gives notice to leave the World Health Organization and stockpiling on drugs known to help alleviate COVID-19 symptoms, there are concerns that any vaccine that is discovered will not be distributed fairly throughout the world. Kate Fisher reports from Washington.
The concern of many in the international community is that President Donald Trump will continue his nationalistic behaviour when it comes to finding and distributing a vaccine for COVID-19. The worry is that either if the US is the first country to get a suitable vaccine for the virus, that he will keep all of those vaccines in the United States rather than trying to help other countries with their vaccine dosages. Also a concern that he will invest heavily in other countries who may find a vaccine first and try to buy up all that stock for the American population. This is called vaccine nationalism, and many are concerned given that President Trump and his Make America Great Again slogan, putting America first, has been such a characteristic of his time in office. There is huge concern that when it comes to finding a vaccine to appease his base as much as anything else, he won't be selling that vaccine to other countries or indeed letting other countries get a fair share of it if it is found in another country. We've already seen evidence of this. Remdesivir, which is a drug that is known to help in the treatment of COVID-19, well, the Trump administration has already bought up all the supplies of that drug made by a US company, which means that no one else across the world can at the moment purchase any of it. So there is real concern about whether once a vaccine to coronavirus is finally discovered, that the Trump administration will try to keep all of it for themselves. Kate Fisher, SABC News, Washington.
The Kingdom of Lesotho has registered the first COVID-19 related death. A team of ministers and border agencies have taken to an inspection tour to witness a beefed up on-site local screening and testing center. At least 134 COVID-19 positive cases have now been confirmed, while 9 recoveries and 1 death has been reported.
Government ministers and border agencies on an inspection walkabout. The exercise is aimed at inspecting on how the new on-site screening and testing functions as more schools and industries gradually opens up for business.
It means we really have to test people more going out, and again, even those who are coming in. Again, numbers have increased because South Africa has opened schools. So our children now have been allowed to go to South Africa to go to schools. So it is very important that we have this testing, so that when they go to school, they have the 14 days certificate that shows that they are COVID-free.
While many Basotho believe that Lesotho has downplayed the reality of the coronavirus and has not done enough to prepare for the worst, the minister admits that a drastic change is needed to be effected as a matter of urgency.
We have changed the whole fabric of the COVID secretariat in order for us to be able to attack or to handle this more vigilantly than we have done before, because we know and we've realized that if we don't do that, most of us are going to die in this country.
The minister says that they have also noted with concern the Ladybrand taxi's conflict with cross-border commuting students' transport and the ongoing violent truck drivers' protests.
And we have now sent the note verbal to them, actually stipulating what we need to be done. The South Africa is willing that some of these issues that are immediate should be attended to, while we're still going to look at the other major things under JBCC and other bilateral and free border movement. But we are saying those that affect COVID, that are immediate, should be done. And one of the things is that we had to rush because we knew that South Africa was going to open schools. We knew that mines were going to be opened. So we wanted to talk about all those things. They are already on the pipeline. They are with South Africa. South Africa is going to let us have free movement as far as those are concerned.
The spiral in COVID-19 new infections have sparked a new debate for Lesotho to reconsider a fresh lockdown, but many believe that it is now in the hands of the citizens to be more vigilant and face a new normal of living with the pandemic. Rapelang Khatebe, SABC News, Masego, Lesotho.
Behind me, the VMR security mine. This is the private security shooting at the mine workers who are protesting. Just look at this. Oh my goodness. Only because the mine workers are saying they want their money. The fact
ensure that I am safe is a problem to me. The fact that I sit with two of my friends and two of us have been raped is a big problem. Me speaking here is not a problem.
At what point do things turn from you seeing me as the queen that I am to a doormat?
This is a fight that we need to fight every single day. And it's probably going to be a fight that we have for the rest of our lives.
Welcome back. Basic education in Kenya will resume in January next year when the COVID-19 curve is expected to have flattened by then. The country's education cabinet member and secretary, Professor George Magoha, announced on Tuesday after the country's president, Uhuru Kenyatta, announced a phased reopening of the country. In a historic first for the country, there will be no national examinations this year. Universities and tertiary institutions will begin reopening in September this year after meeting all health requirements to prevent the spread of the disease.
Schools should only reopen when the daily percentage of confirmed COVID-19 cases have reduced consistently for at least 14 days, which we call in medical terms flattening of the curve, which has just been referred to by the physician who is in charge of this process. C, social and physical distancing is actually the most critical factor in ensuring safety and health of our learners for the reopening of the learning institutions.
And education analyst Amos Kaburu now joins us via Skype. Good evening and welcome to African Perspective, Amos. Did it come as a surprise at all that the government would take such a bold step?
Thank you and good evening to our viewers. This didn't come as a surprise. In any case, there has been a lot of stakeholder engagement that started way back in May. And different stakeholders. Earlier on, the largest teacher union, which is the Kenya National Union of Teachers, was completely opposed to the whole idea of how the stakeholder engagement was happening because they felt that they had been excluded. Yep. But yesterday when the cabinet secretary or the cabinet member was making the decision, he was actually flanked with all these stakeholders. So these conversations have been ongoing. The parent community has been very, very reluctant and skeptical about opening schools unless the situation has been managed. And so it required a very, very tough decision to be made. So actually I agree with your question that it was a tough decision to be made. But it's also important to also put into context that Kenya is undergoing massive curriculum reforms that are also going to be very big come the year 2023 when the whole system is now supposed to shift. We are reducing the number of years in primary school from 8 up to 6. And now secondary school, we are increasing the number of years from 4 up to 6. So these kind of massive changes also by pushing, the ministry could also be using them as part of preparing the country for that big transition that will be happening starting from the year 2023, which now is now taking us now to 2024.
What were some of the reasons that some people have given opposing this particular decision?
Now, first of all, is the fear of the unknown, because at no point in the history of this country did we have a school calendar cancelled. And we have also known that the end of the year comes with a certain rituals, such as national examinations that mark the end of primary education and also secondary education. And now the start of the year becomes when there is a lot of excitement and jubilation that children are transiting to go to new grades. So that is one of the things that stakeholders have been wondering. So how will the year end? But there's a lot of disquiet and a lot of opposition from the private school sector, because up to close to 25% of the children are now currently attending private schools. And so they strongly feel that this decision does not augur well, because it means that the lifeline of the private schools, which is largely dependent on parents paying, now most of the parents are now going to stay away from it. Even some of the virtual learning that was happening is likely now to nosedive. So they feel that the lifeline of such institutions is now heavily threatened. Of course, that is another conversation altogether. Because you also have to balance the interests of the 75%. Because what we know about the Kenyan situation is that if, for instance, schools were to be reopened and something begins happening to those children, we know this is a country that is highly litigious. Some people can even go to court because a case of one child being molested can send this country into frenzy. So I understand why the government should be very, very reluctant to open schools when the situation is not yet stable.
Okay. As an education expert, what would you then say the impact of this would be on how we understand the academic cycle? For instance, children starting at the lower grade, the first grade in primary school. What happens to those children? Because they will those grades would have already been occupied. And then again, when we speak about the universities and the universities' first intake of new pupils or new students.
Actually, you're raising a very fundamental issue, and I had a lot of time to reflect on it today. Because, yes, we are saying that we are freezing promotion or rather transition for the other grades, but we cannot stop children who are young now from joining school. And that also means that technically next year, universities and tertiary institutions will not have students. So I think the ministry is open to negotiations and discussions, and I was just been speaking to a number of stakeholders this evening, and that's now one of the things that we now need to reopen. Earlier on, I was speaking to the chair of the national committee that is managing the whole process of how schools will be reopening, and this has now some of the things that now we have to consider, because our pre-primary has got 2 years, which is what we call pre-primary 1, where children are joined when they are supposed to be 4 years. Now we are saying that we're also going to stay them. So what happens now to those who turn 4 years next year? That means that we will have close to 2.5 million children who will be registered into pre-primary 1 next year, and that means that we'll be having a cohort that will be so big, and yet a cohort that will be coming after them will only be having slightly million children. So whatever way, you will still have created a crisis because you will be always having a surplus or a deficit. This cohort will be requiring more facilities, more teachers, whereas those that are coming later will actually be requiring maybe fewer facilities and such. So I still see that we still have to renegotiate how we actually undergoing this discussion. And now, where I sit, I think that we may still have to reconsider that we really don't have to lose the whole year. We now have to look at a transitional mechanism that makes sure that this year is not completely wasted. Because yes, we have lost 3 months. There are possibilities that we will also regain others. Maybe if we say part of maybe they lost 1 month this year, part of it is to next year as such. And then we look for transitional mechanisms that can facilitate those who are supposed to leave primary school to go to secondary school, and those who are supposed to leave secondary school to join universities. Because in any case, if you are to consider that what they had lost, a child who has been in school for 7 years and now is supposed to sit for the exam has basically undertaken 87% of the curriculum. So we cannot say that they had completely lost anything. And in any case, our grading system is one which says that if a child gets 80%, that child gets a distinction, what we call an A. So that means by now, children are supposed to have covered that 80%, close to 90%. Those who are in secondary school have basically covered 75%. So if we can really have a mechanism that makes sure that we don't lose this year altogether.
But isn't that, Amos, isn't that assuming that the schools were operational? And when Kenya understand that schools shut down in March. So a couple of months have now passed and there was no schooling that took place. So it's not entirely true then that 80% of the work would have been covered.
No. You see, the primary school is supposed to be 8 years. And you know, when you are being tested, you are not being tested for the work for the last grade. You actually are assessed for what you covered from the time you came to school. That's why I'm like, if you've been in school for 7 years, then you've basically covered 87.5% of the entire primary school curriculum. So that's basically, so we cannot argue that just because you had lost the first part of the first semester, what we call here the first term, that therefore it disqualifies that you are completely defranchised or you are completely disadvantaged. So we also have to reopen that conversation so that we don't throw away the baby together with the bathwater.
Okay, I'm going to ask you about what you think about the South African approach, but before we get there, continuing with this cycle of academia, For instance, the job market is expecting a certain cohort of pool of graduates that would be available for the job market. And I know we speak about COVID-19 and we're arguing that COVID-19 has had a huge knock-on effect on jobs, on the job market. But certainly when the economy starts reopening, there would be a need for a new cohort of graduates. Will the universities be able to provide those?
Unfortunately, we have a mismatch. It is not guaranteed that we will have students who are placed immediately after they leave college or institutions of training.
Yeah.
In the case of Kenya, we take it takes an average of 36 months for a new graduate to get placed.
Wow.
So you are talking about already the system is already clogged because you have the cohort of 2017, the cohort of 2018, and the cohort of 2019 who are yet to be placed. So I really do not see that challenge. Of course, when you talk of areas which are really needy, where placement is very fast, such as medicine, actually, I think it will only just be medicine alone, and maybe also some form of crafts which you get from the technical training institutions. These ones have actually been allowed to resume classes in September.
Okay.
When they are actually able to meet that shortfall. But largely, I don't think that the labor market will be affected.
Okay, so as it stands at the moment in South Africa, we have decided to first have the grade 7s, which is the last grade of the primary schools, and also the grade 12s go back to school. Do you think that that's the right approach and probably something that the Kenyan government could consider taking that particular approach?
Thank you. Yes, we had actually that conversation. It was one of the recommendations on the table. And actually, when the president addressed the nation at the start of June, that was the option, to allow for a first approach of reopening. However, the challenge lies in the implementation, because you do not have facilities, or rather a system that is constructed around particular cohorts. You have a system where resources actually target everyone. For instance, you don't have teachers who specifically teach grade 8. You don't have school buses which will be transporting grade 8, or the last grades alone. So you have the resource construction or configuration is one in which it does not have that level of decomposition that perhaps we're speaking to. Now, we also have something else which like our secondary school system is a 75% body in nature. So you have got cases where a quota system is applied, and where you have got maybe only about 20% of the children from certain area, from the catchment areas, who attend those secondary schools. So the rest of the children have to travel, and some of them will even be traveling about 800 kilometers. Now, we do not have a well-structured public transport system, which unfortunately 80% of the children have to rely on it, actually close to 90%. So you have to look at the implementation, where if we were able to say that the factor that determines where you go to school is distance, then it will be a bit different, because you could basically walk to that school which is next to your house. But that is here. You have got children who have to travel for hundreds of kilometers before they reach school. And let's also not forget that this is not an education crisis. This is a health crisis. And so the ministry has been very keen in terms of listening to what the Minister of Health has to advise. And they strongly feel that it is not the right decision to allow children to go back to school at this point in time. So let's also not forget that one.
Thank you so much, Amos Kaburu, the education expert. We really appreciate your time. Indeed, he says that it's a health crisis, but we know it's a health crisis that has become an economic crisis and now also an education crisis as well. Let's move over to this story. As the world grapple with the coronavirus, the labor sector around the world is among the hardest hit as millions lost their jobs. This has prompted global leaders to call for a comprehensive approach to counter the impact of the coronavirus pandemic. The call was made during a virtual summit convened by the International Labour Organization. Chief Guy Ryder said that the virus has plunged the world of work into unprecedented crises.
The COVID-19 pandemic has shattered that world. Every worker, every business, and every corner of the globe has been hit. This crisis is exposing fragilities, many of which the ILO has long been sounding the alarm. Rising inequalities, systemic gender discrimination, inadequate social protection, lack of opportunities for young people, stagnant wages, runaway climate change. The list goes on. Some countries are just entering the worst days of the health emergency. Others are struggling to open up their economies and facing the threat of a dangerous reversal of progress. But let's be clear, it's not a choice between health or jobs and the economy. They are interlinked. We will either win on all fronts or fail on all fronts. This global summit is an opportunity for governments, workers and employers, representatives to shape winning responses. Responses that stimulate the economy and employment. Solutions that support enterprises, decent jobs and incomes. Approaches that safeguard workers and expand social protection. Plans that promote gender equality and reinforce social cohesion. Proposals that protect the most vulnerable and invest in essential workers, such as those in health and care services who are on the front lines of the response. And above all, initiatives that are grounded in unity and solidarity. No country can solve this crisis alone. We are in this together. Strong, effective, multilateral solutions matter more than ever. From the beginning, the United Nations has called for massive global support for the most vulnerable people and countries. A rescue package amounting to at least 10% of the global economy. Developed countries have stepped up support for their own countries, but we are promoting mechanisms of solidarity to ensure that the developing world will also fully benefit. You already have a strong foundation for action and solutions, the ILO Centenary Declaration, as well as the 2030 Agenda for Sustainable Development and Sustainable Development Goal 8 on decent work and economic growth. So I welcome your discussions. You are an essential part of the effort to build back better. Together we can emerge from this crisis stronger, with decent jobs and a brighter, more equal and greener future for all.
I want to pay special tribute to the heroes who have lost their lives while doing their job of caring for patients. We call on countries to put in place decent occupational health programs and infection prevention and control in all health facilities, big and small, public and private, in cities and in villages. Together with the International Labour Organization, WHO has issued guidelines for protecting health workers' safety, as well as manuals for workplace improvement in health services and occupational safety and health in public health emergencies. WHO calls on governments, employers, and workers, organizations in the health sector to develop strong and sustainable national programs for occupational safety of health workers. More than 50 countries have already implemented such programs and demonstrated the benefits in public health emergencies. Together, we have a duty to protect those who protect us.
From health to security, from social systems to economies and livelihoods. Now, as never before, we are being called upon as the international community to hasten our efforts in giving effect to the provisions of the Centenary Declaration. We have to protect working people against the rising tide of unemployment through universal social protection. We have to invest in people's capabilities, in skills development, in lifelong learning, in workplace inclusivity, and also in advancing gender equality. Above all, we have to transform our domestic policy frameworks to support the creation of decent and sustainable work. In so many respects, this pandemic has forced change of a transformational kind upon us. Change that would otherwise have been gradual and slow. It has given added impetus to our goal to make our workplaces more agile, more adaptable, and safer. As we collectively look to the future, we have an immense task before us to rebuild our shattered lives and economies. The African continent has so far had lower rates of infection than many other parts of the world. But because of weak health systems, resource constraints, and pre-existing economic vulnerabilities, the long-term impact of the pandemic on Africa will be quite severe. The African Union has developed a COVID-19 strategy, and as part of that, it has established an AU COVID-19 response fund to assist member states in funding an effective response to the pandemic. Last month, we launched the Africa Medical Supplies Platform, an innovation that will enable all countries on the continent to procure much-needed supplies in a much faster manner and competitive pricing. We are also engaged with international partners and institutions to mobilize substantial stimulus packages to assist African countries to rebuild their economies. Among other things, this will enable us to invest in job creation initiatives, in workplace skilling and reskilling, and to support entrepreneurship, and also to develop small, medium enterprises. The whole world is in the midst of an unprecedented global crisis. But within it lies the seeds of opportunity to deliver greater economic security, equal opportunity and social justice for those who work and for those who have lost work and for those who are looking for work. As we strive to recover from this pandemic, let us continue to be guided by the spirit of solidarity and ensure that we put people and their welfare at the center of all our efforts. And most importantly, that all our responses to this pandemic leave no one behind.
The Marikana massacre robbed many of their loved ones who fought for better living and working conditions. However, there are those that have decided to carry the baton, like Memegwa.
Umphakathi ndiyabaphekela.
Uma ufika umuntu ekhaya athi ulambile okanye unabantwana akukho kudla endlini uphatheka kabuhlungu.
This week, Stories Untold shines a spotlight on this superwoman who saw the need to use whatever little she had to help those in need.
And welcome back. Africa is welcoming a new forum for journalists working on the continent. The Africa Foreign Press Association brings together journalists from various media houses, including the likes of the BBC as well as SABC. The launch comes amid a global crisis that has forced some reporters out of newsrooms, some losing their jobs and others losing their lives. For more on the vision of this association, we're now joined by its inaugural chairperson, Kennedy Wandero, joins us via Skype. Good evening and welcome to African Perspective. Like I was saying earlier on, let me do it on air as well. Congratulations.
Thank you so much.
Yeah. Tell us about the vision of this association.
Yeah, at FPA, we have an outfit that caters for the rights of all international journalists, especially those who are working with foreign media in Africa, covering Africa. They may be outside Africa, they may be in Europe, they may be in the US. So we are trying to bring them together so that at least we can be able to understand how Africa can tell its own story. Because there have been issues, people saying that, certain media houses outside Africa are not reporting effectively about Africa. So we thought it was important that we bring all these journalists who are focusing on Africa to be able to report about Africa effectively, look at areas that require international recognition. And we thought it was important that we have this particular platform so that we can also be able to champion the rights for all the international journalists reporting about Africa.
Yeah. When you speak about Africa telling its own story, how would you then monitor that, and whether the association would be able to influence how the story of Africa is playing out and how the story of Africa is being told, but then at the same time balance that with the autonomy of these institutions as well as their prerogative on how to report on the continent?
Absolutely. What we are doing is we are having regional offices. For instance, our headquarters is in Nairobi, but we intend to have regional branches in Africa countries, especially in North Africa, South Africa, Southern Africa, East Africa, and West Africa. And we are identifying these journalists who are able to champion this particular cause. Now, on whether we are able to champion the rights and able to look at the content that's being reported on Africa, like you've mentioned, we have many journalists reporting for BBC, reporting for CNN, VOA, and other international broadcasters. Most of them are reporting about Africa, but now having them, especially most of these people are the ones reporting about Africa. So if we can be able to look at certain areas of importance other than just reporting about conflicts in Africa, all of us agree that there are essential and very important issues about Africa that we've not yet reported. So if we can only just report about conflict in Africa, then we're missing the whole picture, because they are essential and important things that Africa people appreciate and the world can really appreciate about.
Yeah. What are some of the things that you have picked up then that signals to you as well as the members of the association that there is this story that's being told by foreign correspondents, or there's these stories that are being told about the continent, but they are not a true reflection or genuine reflection of what happens on the continent?
I've just given an example of issues that are being told outside there. One, we have people who have a fixed mind about Africa, who say that Africa is a continent full of conflicts. As it may be the case, but that is not overall the case, because we also have areas that are developing. For instance, we are talking about COVID-19 right now, and we are talking about inventions. We have people from Africa who are coming up with important inventions that are helping governments to fight this particular pandemic. And therefore, if we can be able to identify certain areas or certain countries where we have technological advances, where people are helping the world to fight a global pandemic, then we must appreciate it. Not that it must come from the US, not that it must come from the Europe. Africa has its own wealth, and people can be able to think hard and bring about inventions that can help the continent also be recognized globally.
One of the biggest challenges on the continent as well is funding and the money to run these newsrooms, because newsrooms are quite expensive to run, and we'll get into how COVID-19 has affected the newsrooms. But just on a general basis, that for instance, when I did my honors research for my journalism program, one thing that I looked at was the influence of Xinhua News, which is from China, on media houses in Kenya, for instance, especially community-based media houses, and how they are able to give those community-based media houses news stories to run on their various platforms. So when it comes to that and the type of information that's being given to community-based media houses, what's the association looking into there, or if at all?
Yeah, we intend to work with everyone, especially those who are reporting about the continent. They might be outside Africa or they might be within Africa. And we also, when you look at our association, we have different categories of people who can join this particular association. But majorly we are looking at those who are working with foreign media. But that does not mean that now we go away from the community radio station. For instance, community radio stations are the heart of telling the truth about our communities. So we're also opening opportunities to them so that at least they can be able to be part of us. Perhaps they might not have voting rights in this particular association, but they stand a chance to tell what is happening in their communities and how BBC, VOA, or CNN can be able to work in conjunction with them and be able to tell stories that are happening in our communities. Because, for instance, we heard a story about Kenya Airways in the country, where we had in the UK. Sky News were able to tell that story. Now, Sky News would not have been able to tell that particular story if they were not able to get to somebody in the community who understands the community where the individual is perceived to come from. So we intend to work with everybody on board to make sure that at least we are telling stories about Africa that needs to be given a global recognition, and we tell the story in the way it is, not just the way people have a mind about Africa.
Okay, let's just quickly then touch on the impact COVID-19 has had on newsrooms. And earlier on, we were playing sound bites from the WHO, for instance, and the United Nations Secretary General as well, on how this has impacted on the labor force. And that labor force, of course, including journalists and reporters who are working on the field. And one of our organizations, the South African National Editors Forum, for instance, coming out speaking about News 24, that is closing down a few of its publications, and also the possibility of 510 people losing their jobs who work under Media 24. What's the association's take on what's currently happening in the newsrooms and how we can save some of these jobs?
Yeah, it is a worrying situation, and we must admit that this global pandemic is having an acute effect on the media in Africa. It is not only happening in Kenya, it's not only happening in Nigeria, it's not only happening in South Africa, it's happening everywhere. And we've seen massive layoffs. We've seen people being forced to take pay cuts. So it is a situation that is really worrying, and there needs to be mitigation measures to ensure that at least the media can survive in any kind of unprecedented pandemic or whatever a situation that brings a lot of worry. But now what FPA can be able to do with this is that FPA has several committees that run this particular association. We have what we refer to as Planning, Development and Training Committee. This particular committee is able to check around and see media houses that are going through challenges, and we identify them. We look at individual journalists who've been able to go through such challenges, and we intend to work with them, give them opportunities, because it's not just about employment. Some of them are also facing mental challenges. Individual journalists are facing challenges. So we intend to offer a platform where journalists can be able to partner with us and also tell and help them to overcome such kind of situation. But we also try to voice their concerns to this government, because you realize that certain governments are also withholding a lot of revenue when it comes to advertising. So if they can be able to release that money to individual or to certain media houses, then they can be able to set such kind of situations.
Okay, just quickly, Kennedy, one of the issues that constantly comes up when we speak about journalists is the credibility of the information that they giving the listeners, the viewers, as well as the consumers of the news. How are you going to be dealing with that? Unfortunately, we're running out of time, so I'm going to ask you to please be short and sharp on this one.
Yeah, it's one of the issues that every country is grappling with. But the tenets and values of journalism remain the way they are. So we continue telling journalists that always be able to tell a story looking at the news values. Don't just tell a story bordering on sensation. Do a story that shows the reality of what you're telling about, because the moment you misconstrue or tell something that is not in the real picture, then people also try to doubt what you do. So as an independent journalist, you must always be able to uphold those professional values, because that is the key that helps you to people to understand that you are a professional journalist.
Thank you so much. Yes, they always say that your credibility is your currency. When it comes to journalism. Thank you so much, Kennedy Wandera, chairperson of the newly launched Africa Foreign Press Association. We've come to the end of this evening's show. Thank you so much for watching African Perspective with me, Alderin St-Pierre. We're back again next week, same time, same place. And we're playing out with a bit of a number that is going to get all those nostalgia juices going. However, though, the message is quite important. And you remember that when this song was playing on the airwaves, it was a call on all South Africans, irrespective of race, irrespective of creed, irrespective of class, to come together and make South Africa great. Goodbye.
Peace cannot be so long as humankind is at war. Wars of vengeance will always lead to human destruction and nature. Peace now, not another death later.